All right, we're back. So Jamie, thanks for joining us.
Thanks for having me.
This is the benefit of going at the 6 o'clock hour.
Happy hours every hour.
Happy hour. So, cheers.
Cheers.
So in full disclosure, Jamie and I can talk for hours about innovation in RCM. I think you came out to the VisiQuate labs like a month ago or something?
Yeah.
And we had great discussions at the office, but it wasn't until we got halfway through a bottle of wine that we really started to get into it, right?
Yes.
So, since I know a little bit about that, you got to share, what are you excited about? What are you fired up about? Where do you want to innovate?
The payer-provider collaboration, all day, every day. So I'm super passionate about it. Just, as you learned halfway through that bottle, hands are failing. But what it really is we have so much administrative burden between providers and the payers, and especially like a health system like ours, where the payer and the provider are one entity.
Yeah.
And we spend a lot of money on third parties, like taking my data here and moving it here.
Yeah.
Large health systems can spend almost $70 million annually. It's like taking a piece of paper and hiring a courier to go from the 9th floor to the 8th floor and back.
Right.
So I think there's a lot of opportunity.
It's all your own data, right?
It's all my own data.
Your data back and forth.
Exactly. So Jamie Davis, I won't tell you my age because I'm old, but Jamie Davis, date of birth, blah, 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 lives over here in the provider, lives over here in the payer, and two separate repositories. And whenever Jamie Davis sends something over here, I have to send that information via a third party over here to talk to myself about it.
Yeah.
Right?
Because we have all these like fragmented systems, and it's like, well, why do we do that? And it's like, because that's what we always do. That's the answer a lot in healthcare.
Well, we used to amputate when you had gangrene, but now we have antibiotics, right?
Yes.
So, we're still taking that amputation approach. In the world of where antibiotics are just a commodity, everybody has them, everybody makes them, and we need to start thinking that way.
Earlier today, we were talking to Adrian, who you know, and so one of the questions that I asked Adrian is like, every organization has a different way to get things done inside their own organization, and in innovation, you can do things incrementally. Agile developments, crawl, walk, run. You can go big bang. You can do a little bit like what do you want to do? Like, what are you excited about? What are a couple of projects that you want to get done, and how are you going to do it?
Well, I'll talk about the structure, how we do it, and then I'll tell you the cool stuff I want to do and we as an organization want to do. First and foremost, Adrian's kind of like my other half. We're a balance.
Yeah.
So I'm the person who runs out into the world and comes up with these crazy ideas and then brings them back, and then we go, just like a CEO, CFO, does this make the best business sense? Yep. So we have existing governance and structure for everything we want to do, not just innovation, but if there is a consideration for work to be done, it comes through a central repository that sits underneath my org. And then we rack and stack, low benefit, but quick hit, go do it, and we do that. But the good news is, that sounds pretty bureaucratic, like the DMV, and painful, but it's really not. We turn and burn on solutions fairly quickly, because that's where, especially revenue cycle, we bog down structurally. So we have a really clear, concise intake process, a rack and stack, prioritization, hierarchy, governance, and deployment team. So that's how we handle anything, be it innovative or just I want to change the way I do my billing editor, right? So we're really fortunate to have the scale to be able to have those teams. So it's really great. Things that I'm really excited about, so like I said earlier, payer-provider, because the cool thing about payer-provider is there is a really solid data-based driven strategy there, right? The guy with the most data wins. And so we're looking at the ways that we're exchanging data internally, and I'm probably going to be excited about that until it's finally over and done with. That's just because that's where our cost to collect is driven by. That's where the opportunity is in our industry, quite honestly.
You can see it, right?
It's tangible.
As we've talked about, when we talk about this, it's a pretty clear value prop and use case.
Absolutely.
But since we're in healthcare, and healthcare's always a little bit behind other industries? Like, I mean, what are the challenges? Like, why can't we do things like during COVID with telemedicine? Like, why were we going to take 5 or 6 years?
Yeah.
Well, just because that sounded right.
Yep.
We love journeys in healthcare. We're going to go on a journey, but when your back's against the wall, the whole industry got some amazing things done in telemedicine, telehealth, in 60 days. So that's proof that you can do it. Are you guys using this as an opportunity to kind of say, look at how fast things can get done, and we get some consensus, and we're decisive, and we're unafraid to try things and fail?
Yeah.
Are you taking it? I know you are, because we talk about it, but how do you think about all that?
So I think you nailed it. Like, you have to be afraid to absolutely face plant when you're trying to do something innovative, right?
Yeah.
It's the fearless people who make the change, not the ones who are just sitting on the side waiting for it to happen. And so the good thing about Banner as an organization is they're pretty fearless. Like, 3 years ago, as a department, Revenue Cycle said, hey, give me a bunch of money, we're going to put in all this technology, and we'll give you this return on investment.
Yeah.
And they saw it, said yes, and did it, where if you think historically, other health systems, they don't dump money into Revenue Cycle.
Yeah.
It's into clinical care. So we have the right mindset in our organization. And the second thing that we have to be able to do it on a faster pace is we have the health plan coming along with us.
Yeah.
And that's different. That's the difficult part. But the reason why it's easy is because we found an incentive that works for both of us.
Yeah.
It's not just going to benefit me as a provider. It's not just going to benefit them as a payer. It's not just going to benefit our patient. All three of us get a lift out of what we're trying to do.
Yeah.
And that's what changed the game.
Yeah.
Because our VP over our health plan saw the same thing that I did.
Yeah.
And we went, this makes sense. And so when you think about like slow to adopt, do I think it's going to go really, really fast? No. And here's why. Because if we do this, it's completely disruptive to the industry. And people don't like that.
Yeah.
Yeah. They don't like that because, to your point, this is how we've done it and this is where I'm comfortable.
Do you think there will be, I always like leapfrog moments where you have to build consensus. A lot of the art form, as we know, we talk about it, is it's not the tech, it's the communication and the marketing.
Oh, yeah.
And building consensus, and it's like the military building a coalition.
Right.
So, how do you think about that? Like, what's the relationship between spreading the word versus like pure technology?
Well, I think you nailed it. Yeah. Not that I'm surprised that we agree, but we were able to tell the story in a meaningful way to everybody who was going to be either a stakeholder or affected by it. Yeah. And it's because we collectively, health plan, provider, our change management team sat down and said, how do we make this mean something? Because tech is tech.
Yeah.
We can tell you what code to write or what we want an outcome. You go figure out the code. That's not the hard part.
Right.
The hard part is the systems that drive it. Right? I know, right? It's preaching to the choir.
Yeah.
So I think from a perspective of how are we going to do this and how are we going to do it quickly, we've already got the hard part. We have the health plan. People understand what we're trying to achieve. We're incentivized in the same place. And lastly, we've identified interim lift that isn't huge.
Yeah.
And I think that's what gets you moving forward in innovation.
Yeah.
When someone gets a taste of what can happen, I mean, look at bots. 5 years ago, we got a bot here, we got a bot there. COVID happens, they realize how fast all that stuff can turn and burn, and now everybody and their brothers come to us and go, we want bots.
Absolutely.
So you just have to get that taste of success and benefit, and that's kind of how we do it at Banner. Everything we do pays for itself.
So that's a good point, and that's been in some of the discussions today, which is you could decide to innovate because it is a good idea on paper, but when COVID did happen and we had the Great Resignation is a legit thing.
Right.
When you look at the data of healthcare workers, doctors, nurses, CNAs, billers, collectors, a lot of them are retired and not coming back, and a lot of them went other directions.
Right.
So 3 years ago, it was like AI is going to take away jobs, and now it's like, no, AI is going to replace jobs because there's a dislocation between demand and supply. Is that helping? I assume it's helping to make the case, right? It's like, we don't have a choice.
Absolutely. I think anyone who's worked in healthcare knows that you're never going to get all the work done, so to think that automation is going to take your job is just really short-sighted. But now we understood the reality. Like, some places had 20% vacancy just within the revenue cycle during the pandemic, and we realized, no, we can actually leverage automation to offset the shortcomings we have and have always had that are now that much more apparent because of the impact of the loss of the human resource, right?
Yeah.
So I think that really brought about a reality of we need to get over ourselves and think that bots are going to take our jobs and start helping our human resources upskill and do complex stuff.
Yeah. It's the whole, work to your license has been talked about over the years more in the clinical setting, but you're starting to see people say it now in the back office, right? It's,
totally.
People doing mundane tasks. If a biller or collector, if you can automate 6 forms that they have to fill out over and over in a redundant way, and they can tackle more accounts, the complex stuff, that's just working intelligently.
Exactly.
And it's needed. You don't have the luxury of labor pools that we once had.
Well, it's not just intelligent, but now people have a sense of satisfaction. The majority of the workforce doesn't come in and go, I want to click this button every single time all day long.
Yes.
Right? They want to be challenged. They want to grow. And that's what automation gets rid of. I mean, think about it. If I have a form that takes 15 minutes to fill out and I fill that same dang form out every day, how many hours did I lose doing that? When automation could have just populated it for me.
If you think about how that even goes down to the patient, my wife just recently had foot surgery, and it's the process for auth and the number of paper that you have to fill out. It's crazy. And she used to be in healthcare. She's like, what have you guys done for 20 years? I said, hey, I know.
The same thing.
We've done some cool stuff, but why is it that we're like good at certain digital things, but then there are certain things that just we go back to paper? Just that's what. So they'll fill out paper so that they can rekey it in the system when half of the patient experiences, I've already given you this information 5 times, right? So, I mean, there's still just challenges with change management and behavior changing. How do you guys think about that? Like, how do you get people comfortable with, like, hey, we're gonna go this direction and your clipboards are going away?
Right. Well, just the same way that we talked about payer provider, you have to tell them in a meaningful way. If you tell me my clipboard's going away, but don't tell me why, and don't tell me what you're replacing it, and don't tell me how it's going to make it better, I'm going to be mad. You're taking my clipboard away.
Exactly.
You're freaking me out. And so change management is the key to innovation. You can build tech all day long. I can make all these beautiful spreadsheets and processes, but if I don't make the people who are impacted about it understand the why and be invested in it, it doesn't matter.
And have something, feel like they have some ownership, some actual,
they have a stake in it.
Authentic ownership in it. Like,
exactly, they have a stake in it. The good thing, so at Banner we have a team who's dedicated to nothing but change management. And we tapped into that group when we did what we call our modernization journey, where we did about 30 different projects in 18 months. And they were like little projects, like replacing the billing editor, the front-end workflow, embedding 2 different disparate systems into one. But our change management group were amazing. And we did town halls, we did outreach, we had our own internal social media about it. Without that, we would have never done it. What was amazing is before we did the implementations, we had about an 89% satisfaction rate, and afterwards we had a 90+.
Yeah, that's a good point. This is an opportunity to give the change management, good change management folks and good project management people, they're worth their weight in gold, right?
100%.
They don't get a lot of the glory.
They don't.
They deserve a lot of credit for, again, people love the shiny objects of tech, but it's all the soft skills.
Moving it?
It's all the nuanced things that happen behind the scenes. And a good project manager, a good change agent, it's like night and day difference, isn't it?
You're preaching to the choir, my friend. Well, I'm slightly biased because I have project management in my org, but I've seen it. I've been in organizations because I've really just enjoyed innovation my entire career, so I'm always going somewhere to change things.
Yep.
And I'll tell you what, the core of the success of what we did was our PM and our change management group.
Absolutely.
100%. Because again, you can write code all day long.
Yeah.
I can come up with workflows all day long. But the people who are impacted, if they don't adopt it, good luck. Best wishes.
We see this with our clients. Those that invest in change management and project management, and there's a true collaboration, that's when the implementation kind of goes swimmingly. If there's too much burden on us, which there's some clients that, they don't invest enough in that, and is there a quantifiable impact of that? Yeah. It's
100%.
a 6 to 8 month implementation versus a 3 month implementation.
Look, you estimate the time that you complete it and then identify when you actually complete it. If you don't have change management, count the dollars for every month that you went over.
Yeah.
And that right there is its weight in gold and pays for your change management team 10 times over. 100%.
It's an art form because, it's such a... So let me ask you this, because I know we have limited time, and
Sure.
there is a cocktail hour that we're all supposed to be at. So go out to like 2025.
Okay.
What do you want to really, like if you look back, what do you want to get done by 2025? What's the stake in the ground that you guys got something done that you're excited about?
Yeah. I want to have established myself on a beach somewhere with a cocktail.
Good answer.
But if we're not talking about that sort of focus, no. Okay. So for Banner, I think it's much alignment with our industry, right? So we've removed that administrative burden between us and our health plan.
Yep.
We've automated all the redundant functions and upskilled our human resources, get a higher ROI for those human resources.
Yep.
So that's what's really driving what we're trying to do. And then ultimately, we're migrating host systems. We want to be able to do that without disruption.
Yeah, you have to do it
to our
on a parallel track.
You
right?
have to do it on a parallel track, and we've been pretty successful doing that. So we want to be able to have that material change in the background and still move forward in the industry. So that's what 2025 looks like to me.
Yeah, and that's not an easy task, right? Like it sounds amazing.
It takes a village, man.
But it takes a village, and it takes like that aligned commitment, and so that's another. How do you think about gamification? Like, how do you create all the aligned incentives so that all the stakeholders feel good about it, and there's something in it for them?
So what's really cool is, Banner, we have our LTIs just like every organization, but instead of it's like, our long-term initiative is we're going to do great healthcare. Well, that's a great slogan, but it's not an actionable initiative. So we create really actionable goals, and then we drive those down to the teams, and there's a reward system for it, either be it incentives. We constantly have, especially like in our PAS areas and our back-end areas, we constantly have just what you're talking about, gamification, right? Like, I want to make this like a video game, so when I do it really well, I get that immediate gratification. Because let's face it, our workforce is coming up from millennials and coming up from Gen Z,
that's
that's what they're incentivized by, and that's what they respond to. They don't want to hear me say high five.
It's native to them.
Exactly.
Right?
Exactly.
They expect it. They even demand it.
Shoot, I do. Like every time I do something on my phone and it does a cool thing because I did a good job, my life is good, right? Yeah.
This is closely connected to the concept of, there's white collar and blue collar, and this notion of new collar. So we were talking earlier with Scott Becker and his take in new collar from the standpoint that it doesn't take 4 years to get a degree in something technically anymore.
Right.
You can do it faster. What are the discrete skills?
Right.
You shouldn't pay for memorization anymore, or things that you could look up on your phone, right? So are you guys thinking about that from a training standpoint? And like what you mentioned, millennials, like who are you going to be hiring to help you execute? What kind of skills are you looking for? And are you going to, like, this new collar workers, I think is exciting because it's about getting things done using newer approaches than traditional curriculum.
You know what, I like this question, and I want to be thoughtful about it. So if you think about this, I would say that the way that we want to approach it is that everybody has access to information, right? The things I learned over the last 20-some years in revenue cycle are now readily available everywhere. And so instead of making people, to your point, be memorization, and I can quote all these regulatory requirements to you, we're creating a more intelligent work group because instead of knowing, they actually go and seek and research and self-educate. So we've expanded all of our education platforms, and people just drive off of those things, and that's that. I think that new collar, right?
Yeah.
And I think also the other component to that is really around. I lost my train of thought.
Yeah, go ahead.
Is really going to be. Sorry, some folks are yelling at me.
No, it's because we had a glass of champagne.
I know, like people are yelling over the corner. So I think with regards to the new collar workers, so it's the self-education and moving them to a more complex, but then also when you think about it, so like I think earlier there was a conversation about no-code and low-code app stuff.
Sure.
So empowering our team members to make the changes that they need in their life without it being so regimented and red tape. That's where we're moving.
Yeah.
You don't have to memorize what this insurance does anymore, but you need to improve the way that you're doing it, and we need to empower you to do that. And that's why we can't get things done quickly.
Yeah.
Because there's just a small population of people empowered to do it. Take that power away. Push it out.
Yeah. And make it more exciting and fun. Make learning and skills development aligned with what you're trying to get done. Get people excited about their work, right? I mean, if there's something that we've learned about, millennials and Gen Z is like they have a sense of purpose. They want to be connected to something, right?
Something greater
the greater
than
good
themselves.
principle.
Yes, exactly.
So if they can see how their skills development is connected to something they believe in, and you make it fun and exciting for them, and I think that's where there's an opportunity for AI, machine learning, other
for sure.
thing is to guide them through that in a way that it's just kind of natural. So I guess it's balancing the portfolio. Some folks are going to retire, some new ones are going to come in. It's the ones in the middle that we have to be thoughtful about.
The jaded Gen Xers like us, you mean?
Yeah, exactly.
Exactly.
Because half the time I want to throw my phone across the room.
But then we have to make sure you get that gratification when you pick it back up.
Yes, exactly.
So we actually are, and I know we probably need to wrap up, but within our organization, especially our front-end team has done this really great education platform where now you can get like a Banner University degree. It's meaningful. Like you have something to show for it. You don't just go, I know how to do this. Like I have credentials for it. They're respected within my organization. I'm empowered to make change. So I think that's the way we all have to move, quite honestly.
So this will be our wrap-up question.
Let's do it.
What question should I have asked you that I didn't ask you? Is there any final thoughts?
Final thoughts. You should have asked me if I won the worldwide lottery and I could only spend that money in healthcare, what would I do?
Oh.
That was a good one, right?
That's a really good one.
It's
okay,
champagne.
So I'm very curious as to the answer.
I would make it so that in healthcare we don't submit claims and patients don't pay out of pocket. And I think that's achievable. I don't think that's a pie in the sky. And I would only fund the process and the technology to do it.
That's a good example of like innovation. If certain people didn't ask the questions like, why couldn't you click a button on your phone and have somebody on demand give you a ride? So it's about, innovation's about the right probing questions. If you don't ask that question, then you're not going to do that. So that's a good example of asking, out of the box, insightful questions.
Yeah, I'm not afraid to look crazy. I've been doing it for almost 50 years.
So if you won the
now.
worldwide lottery, how much are you going to keep for yourself versus donate to this grand mission?
Well, if I had to spend it all to healthcare, that's it. But if I get to keep some of it, that's another conversation.
It's like a little bit for the beach, right?
Yeah, that's like another conversation and probably some bourbon versus champagne. But
there we go.
Yeah, exactly.
We have a bottle of that for you. Well, that's a great way to end it. So,
all right, cheers, my friend.
Thanks so
Great
much for
discussion.
joining.
Thank you.
And that's a wrap for today, right? Thank you, friends and colleagues.